So what dermal fillers help with?
Our dermal fillers help with a lot of stuff. First, the most popular dermal filler treatment is lip injection, lip fillers. They would create additional volume or additional height or lift to the lips and hydration as well. Also very popular fillers treatment are for the cheeks because we start to age in the age of 22 years old, unfortunately. And first what we start to lose is a volume in our cheeks. So our fat pads kind of shrink and going down, so the cheek filler helps to support the tissues from the sagging. Also, fillers can help with volume loss in the temple area, which ages women and men a lot, so it's also very helpful treatment. The nasolabial folds, jawline, chin fillers. Skin boosters is one of my favorite treatments because they are like magic eraser for, we don't talk about deep creases and lines, but for some like dryness to the skin, smoker's lines, smile, laugh lines, the skin boosters are the best. My favorite skin booster treatment are hands. So injecting skin booster to the hands because I don't have pretty hands, so my hands are like bony and skinny, so I like to have some hydration and nice like texture to my hands, so skin booster would be the best option. The fillers feels and Botox chills. So Botox relaxes the muscles, but fillers treats the volume loss. Like we kind of replacing the original volume you had with the fillers. It's like a gel. So we just inject, like this is hyaluronic acid. It's completely safe. We all have hyaluronic acid in our body. So it's just like hyaluronic acid gel which injects under your skin.
So usually for dermal filler, how many treatment do you need?
Oh, it depends. So how many filler, let's say you need for lips? Up to 1 syringe. You would never inject more than 1 syringe, 1 milliliter to your lips, but the minimum dose is like about half syringe, it's 0.5 milliliters. For cheeks, I like to inject cheeks with 2 milliliters of fillers. You will see good results, but some clients, some patients, they need only like 1 syringe in total. For the chin filler and jawline, it usually takes 2 to 3 syringes. If you talk about only chin, it's about like half syringe to 1 syringe. And marionette lines and nasolabial folds usually take about 1 syringe of the filler. Temples would need about like 1 syringe, 1 milliliter of filler. Hands are about like 1 syringe up to 2 syringes. It depends how much volume loss you have.
What's the deal with the under eye filler?
I like, for under eye, it's a different zone from all the other fillers, so you have to be careful not to over inject this area. Sometimes I choose skin boosters to inject in the teardrop, sometimes I choose a special filler for this. My favorite is Restylane Eyeline for the teardrop area, and maximum is 1 milliliter.
How long does it last?
The teardrop filler lasts by label about 1 year, but actually it lasts a long time, up to 2 years, because this area of our body doesn't have a lot of hyaluronidase to dissolve it.
Is it the same type of filler that you get all over your face?
No, that's why we have so many different kinds of fillers, because I like this comparison of peanut butter and honey texture. If you compare, like let's say for the lips you would need more like honey texture, for the cheeks or jawline or your chin you would need more like peanut butter.
And do they all last the same length?
So we have so many different fillers in the market. We have the less lasting ones and we have the longest lasting ones. What is the difference between them? Hyaluronic acid fillers all the hyaluronic acid fillers last about, like, it depends on the area, but they last about 6 to 12 months. But some areas hold fillers longer. Some people hold filler differently. It depends on your metabolism. Also, we have stillage fillers. Stillage has mannitol in them. So mannitol is like kind of antioxidant. It prevents your filler from breaking down, and it lasts the longest.
Does it hurt?
It depends on the area. The most sensitive area are our lips, because they're just sensitive, so we can kiss and feel more with our lips. That's why we freeze you for a good 20 minutes. And lips are more sensitive area. Let's say if you get like chin filler or cheeks, it's not very painful. It depends on your pain tolerance as well, but we use all kinds of good tools here to make your treatment less painful.
What to do before?
Before the dermal filler injections, we highly recommend you to avoid any kind of blood thinners, but if you take any kind of prescription medication, please consult with your doctor before you wean them off. But no Advil. We recommend no aspirin. You can take Tylenol for pain if you need. I highly recommend to avoid coffee in the day of the injection of dermal filler, because it will increase risk of bruising. You can take arnica supplements, arnica montana pills 2 weeks before the treatment. It will significantly decrease risk of bruising for you. Also, you have to be 100% healthy. There is no inflammation in our body. We have to make sure, because any kind of inflammation in your body, like sinus infection, cold, flu, COVID, any kind of inflammation, will be absolute contraindication to get your fillers done. Very important note: if you had COVID vaccines like less than 1 month before the treatment, or planning to get any kind of COVID vaccines about 1 month after the treatment, please let us know and we will reschedule, because it's an absolute contraindication. The COVID vaccine, they can cause your body to fight the filler. So it should be like 1 month before or 1 month after the vaccination. Also, if you ever had a history of cold sores, we would like to prescribe you some kind of prevention medication for it, and make sure you don't have active cold sores in the area.
What can you expect after the treatment? What would be normal?
So after your treatment, please don't plan any kind of important events for you, because you can expect bruising, swelling, redness. You cannot apply any makeup 24 hours after your filler injections. You cannot have alcohol 24 hours after your injection. And please avoid salty food, because salt and alcohol will increase the swelling.